Hello, my name is Dr. Daulton Jr., and I want to welcome you to this video where we're going to be discussing herniated disc treatments. And more specifically, what we're going to talk about is what does the research say is the best options for a person who is suffering with a herniated disc. So we're going to talk about the most common things that doctors will usually recommend for this condition, and we'll talk about what actually you can expect with these types of treatments. Now, if you look at the current research about typical treatments that are recommended by most physicians, here's what you're going to find. First of all, medications tend to be the first choice of treatment for most doctors, and many times you're going to be prescribed a combination of painkillers, muscle relaxers, and anti-inflammatory medications. Now, the good news about medications is usually they do provide relief in the beginning, but the problem is once you stop taking them, the pain will usually return, and that's because these are usually just masking the symptoms. They aren't really treating the condition, and they're not causing anything to heal. So of course, if you stop taking them, the end result is you're still going to have the symptoms. Now, one of the major concerns with medications that are usually prescribed with this condition is the side effects. Many people are just not able to function during their normal daily activities while on these because some of them can actually be very potent for a person. Now, the next common treatment that we're going to talk about is injections, such as steroids like cortisone or epidurals. According to a research study entitled Increases in Lumbosacral Injections in the Medicare Population from 1994 to 2001, which was done by Friedli, Chan, and Deo in the journal Spine in July of 2007, these types of injections are effective as little as 18% of the time. So the outcome of the study was that this is not the best option for treating disc conditions, and it certainly isn't the most cost-effective. Also, when injections do help a person, it can be very deceiving because, yes, the pain goes away, but the problem is that the underlying disc condition didn't actually heal. So you think that you're okay, and you continue going about your life and doing all the things that got you into this problem to begin with, and then once the injection wears off, all of a sudden the pain comes back, and sometimes it's even worse, and it's more difficult to treat at that point. The next common treatment that doctors usually recommend is physical therapy. Now, I want to let you know that I am a huge fan of physical therapy. However, I believe that physical therapy needs to be done at a certain time and in combination with other treatments if you want to experience the most benefit from it. So just keep in mind with physical therapy, there's an appropriate time and a place for everything, and it's important that you use certain treatments such as physical therapy in an appropriate order so that you get the best results that you're looking for. Now, surgery is the last resort, and there's very good reason for this. First of all, studies have shown that the success rate of conservative care is much better, or at least equivalent to surgery. Now, you might be wondering, what exactly is conservative care? Well, conservative care is pretty much anything besides surgery, and there's a lot of different options available to you, but many doctors aren't aware of the options, so we'll talk about that in just a minute as well. Now, you'll notice on the screen I have some research studies here, and the first 4 research studies that I've listed here are just a few of the studies that have shown that conservative care usually has a better outcome than surgery does. And because there can be complications with surgery, most doctors will try everything else first, because why would you take the risk of going through surgery if you can experience relief using more conservative methods? And in fact, one of the biggest concerns about surgery is the failure rate. According to the study, Related Factors with Failed Surgery of Herniated Lumbar Disc, which was done by a research hospital in Spain, the failure rate of spinal disc surgery is as high as 40%. That means that at least 1 in 3 people who have spinal disc surgery will not experience relief. Now, in addition to that, they found that the failure rate increases to over 50% when an individual has surgery more than once. So if you're in that position where you've already had surgery and you're considering another surgery, you need to think really seriously about that, especially if your first surgery failed. Now, another concern with certain types of surgical procedures is that they can actually cause the disc to degenerate more quickly. That means that you develop arthritis in the disc a lot faster than you would if you hadn't had those surgeries. So, for example, a study in the Journal of Spinal Disorders and Technology, which was entitled Accelerated Degeneration After Failed Cervical and Lumbar Nucleoplasty, showed that 42% of the people who had this type of procedure showed more degeneration within the treated disc a year after the procedure than they would have if they never had the procedure at all. So these are things that you want to take into account when you're considering what treatment you should go through for your condition. Now, one thing that we want to keep in mind is that A lot of times a doctor will tell you that a disc condition cannot heal, and that actually is not true. The problem is they're just not up on the most current research on this topic. So let's talk about research that shows that the disc condition actually can heal without surgery and without some of these other treatments. Now, in the first study that I've listed here, which was done in China at the Wangjing Hospital of China Academy of Chinese Medical Sciences, they found that 79.2% of the patients who had herniated discs and were treated with conservative care actually showed that the disc was healing on a CT scan. Now, what this means is that the herniation itself actually sucked back into the disc and the wall of the disc showed healing. And these results happened in just a 3-week period of time. So that's pretty amazing right there. And the second study that I have listed here, they actually show the same results. And in fact, in these cases, the disc had actually ruptured, which is the worst case scenario. And the CT scan showed that the fluid that had leaked out of the disc was reabsorbed by the body, and the disc was healing in just a matter of 3 months. So obviously, after looking at all this information, the best option for any type of a disc condition, whether it be a herniated disc, a bulging disc degeneration, the best option is always going to be conservative care. So what is conservative care then, more specifically? Well, what I've done is I've actually created a program that outlines all of the most impressive conservative care options that are available to you, and basically it gives you a step-by-step plan of what you would want to follow in order to achieve really good results with your disc condition. Basically with this program, what you would get is you would get the book that I've written, which outlines all the steps that you need to take in order for healing. It also gives you email access to me, so if you have questions along the way, you can feel free to email me. And I even have some customers who they want to send me their MRI results, and I'm more than willing to look at that for you and see if what the best options would be for you, or if there's any additional recommendations besides what's in the book that you need to follow. So that's something that I do offer for people who are interested in learning more about conservative care and what you can do to heal a herniated disc or any other disc condition. And if you're interested in that, you can actually go to the website that's listed at the bottom of the screen here. And also, if you're on YouTube right now watching this, there should be a link in the description that will take you there as well, and you can just click on that link and it'll take you right there to learn more about the program. Alright, thank you so much for spending this time with me here today. I hope you found this information useful, and have a great day.